Ms. Chu, you're recognized.
Mr. Carlson, while the topic of today's hearing suggests interest in improving health care for seniors, Republicans are charging ahead with their reckless plans to cut as much as $880 billion from Medicaid. Medicaid's the primary source of payment for long-term services and supports in this country. It's impossible to ensure quality care while gutting the very program that pays for long-term care services for roughly 9.3 million older adults and people with disabilities. Without Medicaid, most older adults who need help with daily activities would not be able to afford home-based or nursing facility care. Medicaid also helps older adults pay their Medicare cost sharing and covers vital benefits that Medicare does not, such as dental, vision, hearing, and non-emergency medical transportation. Over 900,000 older adults and people with disabilities receive coverage for essential long-term services and supports through Medicaid or Medi-Cal in California, including at-home care and care in institutional settings. At $83,000 per year for out-of-pocket home care and $147,000 annually for nursing home stays, long-term care is unaffordable without Medicaid. Medicare only pays for limited days of rehab after a hospital stay or for in-home skilled nursing care if the beneficiary meets the strict definition of being homebound. And most non-skilled long-term services and supports such as personal care or routine care are paid for privately or provided by unpaid caregivers until individuals deplete their savings and eventually become eligible for Medicaid long-term services and supports, which is why cuts to Medicaid are so damaging for Americans who need long-term services and support. And this includes people like my constituent, Chi Kwang from Monterey Park, California. When he heard about Republicans' plans to cut Medicaid, he called my office and said, I am a 74-year-old who's worked for 40 years as a warehouse worker. After decades of hard work, I now rely on Medicaid and Medicare for life-saving medication and medical care, especially after undergoing hip and spine surgery. I also heard from people like Bailey from Alhambra, California, who said, my daughter has a rare genetic disorder and many health problems. I'm worried about what will happen to the help that I'm receiving for her through Medicaid. Without this, it will be impossible for me to take care of her alone. Mr. Carlson, I've read the documents of Justice in Aging, and I am very interested in what it has to say about the interaction between Medicare and Medicaid. How would Republicans' Medicaid cuts affect the ability of seniors who rely on both Medicare and Medicaid, like Chi Kwang, to afford their health care? How would these cuts affect people with disabilities, like Bailey's daughter, in accessing long-term care services?
Thank you. I can make some additional points to the answer that I made a second ago. As you noted, Medicaid helps people pay Medicare premium, so the Medicare savings programs, that's something that's used by 10 million older Americans to cover the significant expense that the Medicare requires, for example, the Part B premiums, which are $185 a month. So there's significant expense that Medicaid helps with that otherwise many people can't cover. I'll note also that Medicaid, given the really high long-term care expenses that you note, is a lifeline for people really from a multiplicity of income levels. You can have significant life savings and be middle class or thereabouts or above. And if you find yourself at a need for nursing facility care, paying private pay at $100,000 a year, you spend down to Medicaid levels very quickly. So Medicaid is just a rock bottom safety net program that provides something that no other program provides for the folks like your constituents that you mentioned, people, older people and individuals with disabilities who need this kind of long-term service and supports, whether it be in a facility or at home. Medicaid is the only thing that's available for them. They can't afford it otherwise. Medicaid specifically pays when otherwise people can't afford it. And so the cuts that have been proposed here would be devastating for the Medicaid program and devastating for the people that rely upon it.
Thank you. I yield back.